So Sharon, I know that when a person finds out that they have HIV, there are a lot of things that go through their minds, a lot of feelings that they go through. So what has it been like for you?
I just can't believe I'm positive. I've been thinking a lot about what I'm going to do and how I'm going to tell my family.
It sounds like a lot to go through, and you made it here today to speak with me. How have you been able to cope?
I don't know, I try not to think about it, and I get busy with taking care of my family, the kids. You know, it helps me not worry so much, but I'm scared.
It sounds like you have some concerns about what to do now that you know that you're HIV positive. Finding out you're positive can be very difficult. What do you think you're most worried about?
I guess I'm just scared that my family and friends won't want to be around me because they'll be afraid of me or something.
So having friends and family around you is really important. It helps you focus on getting through tough situations. So are you worried that if they know that you have HIV, that you might not have their support anymore?
Yeah, I've done some stuff that my mom hasn't been too happy about in the past. And I know she's not going to be happy about this.
Mm-hmm. Tell me about that.
Well, I had 2 kids when I was pretty young. My mom never wanted me to end up like her. You know what I mean? By the time I was 19, I had 2 kids. I was living with the second kid's father, and things were just not working out between him and me. So I ended up moving back with my mom.
What was that like?
It was a nightmare at first. I mean, I was trying to be a mom and I was like a kid myself. Somehow my mom and we did manage to work things out.
Really?
Yeah, now my mom really helps me take care of my kids.
So you were able to get your mom's support?
Yeah, that's true. I guess my mom has stuck with me, and her support helped me make my situation a lot better.
Mm-hmm. In what ways?
Well, now I have a job, you know, I can help her out. It feels good to be able to provide for my kids without having to ask for my mom's support. But at the end of the day, you know, they are my responsibility.
It sounds like to me that you're able to meet your big challenges when you are faced with them. And you have the ability to do what it takes to get a job and to keep it in order to support your children. And I know you were worried about how your mom would react, but things didn't turn out the way you expected.
Yeah, that is true.
Mm-hmm. I see this as important because it shows me that you've been successful in the past with dealing with things that were really hard. We talked earlier when I introduced the program to you about the fact that we would focus on strengths. Your skills and your abilities that you have and your past successes that you can build upon to help you with your concerns about living with HIV.
What do you mean?
Well, it took courage for you to leave your children's dad when the relationship wasn't working. You said you didn't want your children to have a bad life. And so you made a choice to move back home even though you knew it could be tough. And you were worried about it, but you made it work.
Yeah, I guess that's true.
Do you think that you can rely on the support from your mom to watch your children if you had a doctor's appointment?
Yeah, I mean, she does that right now. Whenever I have to go to a doctor's appointment, she'll take care of the kids. I'm just wondering if she'll, you know, question me for going to the doctor a lot.
What's a lot?
You know, like once a month.
Okay, that would be a lot. Most people living with HIV don't have to go that often.
It's not only my mom, it's my friends and my boyfriend Charles.
Tell me about Charles.
Okay, so Charles and we've been going out together for like the last 9 months. We were at this party and we just clicked. You know, my friends thought we made a great couple and we hooked up that night.
Sounds like you're definitely interested and excited, and that's great. Does he know about your HIV status?
No, and I really don't know how to tell him either. We're really getting along and I feel like we're connected, we're in love, and I'm just afraid all that is gonna end, you know, once I tell him.
You're not sure how he'd react?
I guess we're doing well and I don't want to screw things up. I'm scared of what would happen. The test counselor did say something about partner notification. Does that mean I have to tell Charles?
You said you're really connected, so I would imagine that letting him know that you have HIV is going to be important. Partner notification is about different ways to tell your partner that you have HIV so that they can get tested and so that they can work on getting into medical care, just like we're doing with you. And so I wanted to ask you, did your test counselor give you more information about the whole process?
Yeah, they gave me a fact sheet about the laws and regulations and stuff like that, and I read it. They asked me about all the sexual contacts I had, but I haven't been with anyone except Charles since my last HIV test. We never used condoms in the past, so really I don't know if I gave it to him or if he gave it to me.
What did you think after reading the fact sheet?
I know I should tell Charles, but I don't know how. Is that something you can help me with?
Talking with partners about HIV is something that comes up for just about everyone living with HIV. You and I can talk about different ways to do it, but I can't tell Charles for you. I would be more than happy to refer you to someone that can really work with you on your options in telling Charles. So Sharon, what do you think are some of the advantages of telling Charles?
Well, if he's positive, then he can get some medical help. And if he isn't, then I guess we could try to make sure he doesn't get it too.
Do you think it would be easier for you to see a medical doctor if Charles knew your status?
I really don't know. I feel like I can't think about going to the doctor before I talk to Charles and my mom.
So you're saying that deciding when and how to tell them is the first step towards getting into care?
Yeah, that's about right. I know I should tell them, but I'm just not ready to. I don't even know that much about HIV. I think I need to know a little bit more before I have that conversation with him.
Seeking out more information shows your commitment about learning more about your health needs. I have some information about HIV that I'd like to share with you if you'd like.
Yeah, that would be helpful.
And here's a fact sheet. What questions do you have at this time about HIV?
I mean, I see people with it all the time. They look healthy. I guess it's not a death sentence anymore.
That's right. It is a manageable disease, especially when the person living with HIV is taking control of their health by going to see a doctor, by following up on their recommendations, by watching their nutrition, and just overall being an informed patient.
That's good to hear. I want to stay healthy, and I feel pretty good too. I don't think I need a doctor right now, though.
Sometimes people feel that seeing a doctor is only for times when they're feeling sick. But with HIV, it's really important to see medical providers when you're feeling well so that you don't get sick in the future.
Well, I mean, I do take my kids to the doctor for checkups, but since I don't have health insurance, I just go when I really need to, when I'm sick.
Most people worry about how to pay for medical care, and we'll talk about some of our options during the ARTAS sessions that we'll do together.
Sure. I just don't think I really need it yet. I feel okay, and I'm more worried about how I'm going to tell Charles and my mom.
I hear you. You've said that you need to tell Charles and your mother before you link to medical care and that you feel healthy. And because you feel healthy, this is a great time to think about getting into medical care. Early treatment has many benefits for people living with HIV, and it can improve your long-term health and actually saves you money over the long run compared to waiting to get into medical care later.
Yeah, that sounds good. But the money right now is not really the problem for me. I really need to tell my mom and Charles and then figure out the rest.
Sharon, you're already taking steps towards caring for your health by coming here today. You've told me about the information that you need, and you brought up some of your concerns with living with HIV. We'll continue to explore options for paying for your medical care during our ARTAS sessions together. Speaking of which, there are a few tools that we'll be using together in ARTAS to help guide our work together. And so this form here is the strengths assessment form. And so this form is going to help us keep track of the strengths that we identify during the sessions, and how we might be able to use them to your advantage in seeking medical care. So let's look back at some of the strengths that we talked about today. What do you remember from what we discussed?
Well, I think I'm a good mother.
So what strengths do you bring to your role as a mother?
I'm always trying to do what's best for my kids.
And how do you do that?
I guess by working hard, and being good at my job so I can keep it and basically be able to provide for them.
You've talked a lot about how important your children are and the hard work you do to support them through your job and really putting their needs first.
Yeah, I know they need to be my number one priority.
It seems that you feel the need to move forward and make health a priority. You're taking the steps to do that by seeking more information about HIV.
I guess I didn't think about that, but yeah, I do know I need to work on my health too. I just thought that I was doing what I had to do. I guess working on my health also shows, some strength. I guess my relationship also shows some strength, and I am close with my mom and my boyfriend.
Having and being able to create a support system like that is great, and it's definitely a strength, especially after all the things that you've gone through with your mother. Think about how things have changed since you moved back home.
Absolutely. It's definitely helped me get through some difficult times before.
Another form that we'll use to help identify some challenges and some goals along with your strengths is the session plan. Here's the session plan. We will fill this out based on your goals that we identify in the sessions that when we work together, and we'll use it to keep track of your progress as well. So let's look at the session plan and fill it in with some of the goals you'd like to work on during your next sessions. And this will help you draw on the strengths that you identify to help you achieve those goals as well.
I know I need to, get into medical treatment, but I need to do some other stuff first. I have to tell Charles, I have to tell my mom, and I also can't go until I find a way to pay for medical treatment.
So you're saying your goal is to link to medical care, and there are some other things that you want to do first. You want to disclose your status to your mom and to Charles, and figure out how to get assistance for paying for your medical care. We'll break these goals and these objectives into specific activities that you can do towards achieving each one. So did I capture what you were saying about your goals correctly?
Yeah, that looks right.
Okay, so here's a list of medical providers in the area. Review that, and when you're ready, we'll discuss it in the next session.
Okay, I'll take a look at this.
Do you have any additional questions before we finish up today?
No, not right now.
Okay, so Sharon, thanks for coming. I know that you have a very busy life, and so taking time out of your day to come here shows that you're really dedicated to your health. And so here is my card, right here. And I'm here Monday through Friday. And so you can call me in between sessions if you have any questions. Here is your appointment card as well for our session next week. And if you need to reschedule, just give me a call and we can certainly do that. So thanks again, Sharon, and I'll see you next week.